Hello, everyone. So, this is a small talk on uterine fibroids. So, I'll be discussing about the uterine fibroids, how they develop, what are their symptoms, and their management. So, what are the fibroids? These are innocent growths which develop in the uterus, that is in the womb. They are also known as uterine myomas or leiomyomas. They are non-cancerous growths and they can be as tiny as a pea or as big as a melon. Why do fibroids develop? So, exact cause of fibroid is unknown. They have been linked to the hormone estrogen, and estrogen is the female reproductive hormone which is produced by the ovaries. Fibroids usually develop during a woman's reproductive years from around the age of 16 to 50, and when estrogen levels are at their highest, and they tend to shrink when estrogen levels are low after the menopause. So their growth is more or less dependent on the hormone estrogen. There are different types of fibroids, so they can be classified by their location in the uterus. So one is the intramural fibroid, which develops within the muscle of the womb wall, and these are the most common. So you can see here, this one is the intramural fibroid. Then we have the subserosal fibroid, and they grow on the outside of the womb wall. These can grow very large. So this one is the subserosal fibroid. Here you can see the number 2, and they grow on the outer wall of the womb. Third type is the submucosal. They develop in the womb wall and they grow into the womb lining. So this is the third type, that is the submucosal, and it grows inside in the womb lining. Who gets fibroids? So these are common, with around 1 in 3 women developing them at some point in their life, and they most occur in women aged 30 to 50, and the most common in women of Afro-Caribbean origin. They occur more often in women who are overweight or obese because of the higher levels of estrogen from the fat tissue. And women who have had children, they have a lower risk of developing fibroids, and the risk decreases further the more children you have. So having children is a protective factor. What about the symptoms of fibroids? So all women don't develop symptoms. Around 2 out of 3 women who have fibroids will not be having any symptoms, and fibroids may be found incidentally on a scan. Symptoms depends upon the site and size of fibroids. So around 1 in 3 women with fibroids will have symptoms like heavy periods, which is a very common symptom of fibroids. There can be periods with passage of clots and flooding. Periods can be painful at times. Women can have tummy pain, lower back pain, frequent need to urinate, and they can also have some pain or discomfort during sex. Constipation can be there. So these are the symptoms of the uterine fibroids. The most common is excessive menstrual bleeding, and this can lead to anemia. Because of the pressure, because of this growth, there can be frequent urination, painful intercourse, and also they can cause infertility in some women. There can be pelvic pain or pressure and low back pain. So how are fibroids related to infertility? So submucous fibroids, they can affect the fertility, although it is unclear how. It is possible that a fibroid may prevent an embryo from implanting in the womb, but having fibroid does not necessarily mean that you will have trouble conceiving. Many women with small fibroids, they do conceive and they have successful pregnancies. There are some fibroids which can distort the uterine cavity, and this can contribute to early pregnancy loss as well. And during pregnancy, these fibroids can grow in size, and such large fibroids can outgrow their blood supply and they can cause pain, as well as making the baby lie in an unusual way, which is known as the malpresentation. What about the fibroids and their relationship to cancer? So fibroids are very rarely associated with cancer of the womb muscle, and these cancers are thought not to arise from the fibroid itself. what about the treatment? So if fibroids are asymptomatic, they're not causing any symptoms, so no treatment is needed. And treatment of fibroids depend on which symptoms you are having. So there are some medications which can be offered to treat heavy bleeding because of the fibroids. If medications don't help, then we go for the surgery. So if the woman is having heavy periods, then there are medications which are very effective in reducing the heavy bleeding, but they may not necessarily shrink the fibroid itself. So there is this Mirena coil. Actually, it is a small plastic T-shaped device which is placed in your womb that releases the progesterone hormone levonorgestrel. So you can see here in the picture, this is the Mirena coil. It is a T-shaped device and it is inserted inside the womb and it releases the hormone progesterone. So it also acts as a contraceptive, but doesn't affect your chances of getting pregnant after it is removed. It works by thinning the lining of the womb and making the bleeding lighter, but it can cause some side effects, like initially there can be irregular bleeding for about 6 months. It can also cause acne, headache, breast tenderness or discomfort, and periods can stop completely in some women. Then there is tranexamic acid tablet. They work by stopping the small blood vessels in the womb lining and they decrease the risk of bleeding. They reduce the blood loss by about 50%. They are taken 3 times a day during the period for up to 3 to 4 days, and mainly they are taken for 3 months. And if the condition does not improve by 3 months, then the treatment has to be stopped. These tablets, they are not contraception and will not affect your chances of becoming pregnant. They can have some side effects like indigestion and diarrhea. Then we have non-steroidal anti-inflammatory medications. Common ones are ibuprofen and mefenamic acid. They can be taken 3 times a day from the first day of your period until bleeding stops or bleeding reduces to manageable levels. They work by reducing your body's production of a hormone-like substance called prostaglandin, which is linked to heavy periods. They are also painkillers, but they are not a form of contraception. They can also cause side effects like indigestion and diarrhea. Then there is contraceptive pill. It stops the release of egg from the ovary, therefore prevents pregnancy as well. They make the bleeding lighter and can reduce the period pain. Then other medication is the hormonal one, that is the oral progesterone, and they are taken as tablets from day 5 to day 26 of your menstrual cycle. That is at least for 3 weeks, and they work by preventing the womb lining growing quickly. It is not a form of contraception, but it can reduce your chances of conceiving while you are taking it. Then there are injected progesterogens, and this forms of progesterone can be injected once every 12 weeks and also act as a contraceptive. It can cause side effects like weight gain and irregular bleeding, absent periods, bloating, fluid retention, and breast tenderness or discomfort in some women. And these injectable progesterogens, these are known as injection depot medroxyprogesterone acetate or DIMPA in short form. Now, there are certain medication which can shrink the fibroids. So one of them is the GnRH analogs, and it is an injectable hormone which temporarily switches off the ovaries by stopping them from making estrogen. So the hormone estrogen is not produced, and this causes a temporary menopause, but your periods and fertility will return to normal after you stop these injections. It can cause some side effects like hot flushes and vaginal dryness, which can be treated with a small amount of estrogen hormone replacement therapy. There is an average 35% reduction in the fibroid size after 12 weeks of treatment. And this medication is only licensed for 6 months, and the fibroid may grow back to its original size 4 to 6 months after stopping the injections. Now, what about the surgeries? So if the medications are not successful in relieving the symptoms, or if the symptoms are severe, then surgery may be offered. So one type of surgery is the hysteroscopic resection of fibroids. So what does it mean? There is an instrument known as hysteroscope in which there is a small camera, and like small surgical instruments are passed up through the vagina and cervix into the womb in order to remove the fibroid from the inside of the womb. This can be performed for fibroids like submucosal fibroids, which grow inside the womb cavity in women who wish to become pregnant. The procedure is often carried out under general anesthetic, that is, after like you will be put to sleep, although local anesthetic can also be used. And it is a simple procedure, and if it is successful, you can usually go home on the same day as the procedure. Now, there is another surgical method, that is myomectomy. So it is it is an advanced surgery, and it is an operation to surgically remove the fibroids. It can be done either through the keyhole surgery, that is laparoscopy, or the open surgery. So it is an alternative to hysterectomy, that is the womb removal, if you would still like to become pregnant and you want to preserve your womb. These operations are performed under general anesthetic, that is after putting you to sleep, and you may need to stay in hospital for a few days. And it is a major surgery. However, fibroids can sometimes grow back even after myomectomy. Then there is another surgery, that is hysterectomy. So what does it mean? It means surgical procedure to remove the womb. It is the most effective way of preventing fibroids coming back, and it may be recommended if you have large fibroids or severe bleeding and do not wish to have any more children. This operation can be carried out through the keyhole surgery or the open routes, depending upon the size and number of the fibroids. And operation is performed under general anesthetic, that is after putting you to sleep. It is a major surgery, and you may need to stay in the hospital for a few days. The recovery can also take longer time. And if ovaries were also removed, then this would cause you to have the menopause symptoms. Another method to treat the fibroid is the uterine artery embolization. What does it mean? Actually, it is a procedure which is carried out by radiologist. It is performed under local anesthetic, which means you will be awake, but the area will be numbed. So in this, a small tube, that is catheter, is inserted into the femoral artery. Here you can see this is the femoral artery, okay, in the leg. And then this tube is guided up to the uterine arteries, which feed the fibroid. Now, these blood vessels are blocked by fluid containing many tiny particles, causing the fibroid to halve in size after 1 year. Around 80 to 90% of women have a significant improvement in their symptom after 1 year. And once fibroids have been treated like this, generally they do not grow back. And most women find it takes about 6 to 9 months to resume a regular menstrual cycle. Although it is possible to have a successful pregnancy after having uterine artery embolization, the overall effects of the procedure on fertility and pregnancy are uncertain. It is offered to women whose family is complete. They can cause some side effects, like immediately after the procedure, you may experience pain, and for that, you will be given the painkillers. You can also have fever as the fibroid breaks down. Some women will have vaginal discharge, which persists for a few weeks to months. And there is also small chance of severe infection, and in very severe cases, may necessitate hysterectomy, that is, womb removal. In few women, this procedure may lead to premature menopause, and this occurs usually in women who are 45 years or older. There is another procedure known as endometrial ablation. So this procedure involves heating the lining of the womb to reduce heavy bleeding. It can also be used to treat small submucosal fibroids encroaching on the womb lining. This is also appropriate for small fibroids of about less than 3 centimeters in size. The procedure is a very short procedure. It takes only about 20 minutes to perform, and it is generally carried out under local or general anesthetic. Some women can still have bleeding after this procedure. And pregnancy after an ablation could be dangerous, so you must be sure to use reliable contraception. So, this is all about the fibroids and their treatment. I hope this was helpful. So, I shall be uploading a few more videos shortly. Stay tuned and do like and subscribe to my channel. Thank you. Thanks for watching.